Drinking coffee can do this to your body. Using the roasted beans of coffea fruit, coffee is a well-known beverage. Along with chlorogenic acid, it has caffeine. And caffeine affects the body through stimulating the heart, muscles, and central nervous system, CNS. The body's ability to control blood sugar and metabolism, as well as blood vessels, may be impacted by chlorogenic acid. To improve mental alertness, people most frequently consume coffee. There are numerous more conditions for which coffee is used, such as diabetes, cancer, heart disease, high blood pressure, dementia, etc. Although the majority of these uses lack solid scientific backing. Green coffee, black tea, and green tea are all caffeine-containing beverages that should not be confused with coffee. These two are not similar. When eaten orally, coffee is a popular beverage. Most people can probably safely consume up to 4 cups of coffee each day. But more than 4 cups of coffee a day may be dangerous. Due to the caffeine concentration, excessive consumption may have negative effects. These negative effects, which range in severity from minor to severe, include headache and irregular heartbeat. Coffee may not be safe when administered as an enema, rectally. Coffee enemas have been associated with instances of serious side effects, including death. Special precautions and warnings. Pregnancy. Coffee used during pregnancy may be safe in moderation. Attempt to limit your daily coffee intake to 3 glasses. 300 milligrams of caffeine is contained in this. A higher chance of miscarriage, a higher risk of sudden infant death syndrome, SIDS, and other unfavorable outcomes, such as neonatal withdrawal symptoms from caffeine and a lower birth weight, have all been associated to exceeding this limit while pregnant. It is also potentially dangerous. Breastfeeding. Coffee used while breastfeeding may be safe up to 2 cups per day. Larger quantities, however, could be dangerous. Breast milk carries the caffeine from coffee. Infants who are breastfeeding could become agitated and have more bowel motions as a consequence. For children, when ingested in the average levels found in food, caffeinated coffee could be safe for kids' meals and drinks. Disorders of anxiety. Caffeine in coffee may exacerbate anxiety. Coffee may exacerbate the symptoms of mania in people with bipolar disorder. Blood clotting issues. Caffeine in coffee may impair blood coagulation and exacerbate bleeding issues. Coffee use does not appear to raise the chance of developing significant heart disease problems. But if they drink coffee regularly, persons who smoke and have heart disease may be at a higher chance of dying early from heart disease. Diabetes. Coffee's caffeine content may have an impact on blood sugar. If you have diabetes, drink coffee with caution as it may cause hypoglycemia. Particularly when consumed in significant doses, can exacerbate diarrhea as well. Seizures. Caffeine in excessive doses should be avoided by those who have epilepsy, and small dosages must be handled with caution. Glaucoma. Caffeinated coffee consumption raises ocular pressure in glaucoma. Within 30 minutes, the rise starts, and it seems to last for at minimum 90 minutes. Drink coffee with caution if you have glaucoma. High blood pressure. Coffee with caffeine may raise blood pressure in those who already have hypertension. However, it doesn't seem that those who routinely consume it will experience that. Caffeine can cause IBS. Coffee's caffeine content, especially when consumed in excessive doses, may make diarrhea and other IBS symptoms worse. Caffeine-related incontinence. Caffeine can worsen bladder control by making it more difficult to manage the frequency and urgency of urination. Smoking. People who smoke and drink coffee may be more likely to pass away from cancer or heart disease. Bone thinning. Osteoporosis. Caffeinated coffee consumption can increase the quantity of calcium excreted in the urine. This could make bones fragile. Limit your daily coffee consumption to 3 cups, even though the risk of developing osteoporosis does not appear to be increased by consuming roughly 4 cups of coffee per day if you are typically healthy and have enough calcium through your diet or supplements. Hopefully these were useful informations. Stay healthy, and if you like this video, please press the like and the subscribe button and share this video as well. Lastly, I want to say thank you for watching with smiley face.